ahead and get started. Hi, everyone. Good afternoon. Welcome to our April session for our San Joaquin Stanislaus Collaborative Planning and Implementation. Hope you all are doing well. Just a few housekeeping reminders that I'm sure you all are very familiar with. We are recording this session and we will have the recording available afterwards if you would like to take a look. If you haven't already, we just ask that you update your Zoom name with your name and your organization, just so we know who's in the room. For today's icebreaker question, we thought it would be fun to ask everyone what TV show they're currently watching. So please feel free to put that in the chat and maybe some of us can get some good recommendations for shows to watch. And then, as always, we have a very engaging session planned and really encourage you all to listen in, ask questions as questions come up. Feel free to use the chat or unmute to ask questions. So looking forward to today's session. If you are joining today's session for the first time, do want to give a warm welcome. Our CPI meetings are a space for regional CalAIM stakeholders to come together to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and utilization. So welcome aboard. Please ask questions as things come up, and we're always here as a resource. I did want to take a moment to pause just to ask if there are any folks that are joining today's meeting for the first time. It would be great if you could unmute and just share a quick intro. I think we would all appreciate getting to know if there's anyone attending for the first time. Do we have any new folks today?
Good afternoon, everyone. My name is Shelley. I am from Premier Senior Living Management. Been working with the Sacramento and the Fresno group, and so we do have a lot of communities that we service or operate in the San Joaquin. We are an assisted living memory care. We provide multiple location, and so we service the elderly homeless population and providing housing. We are expanding the services to becoming more of like providing a well-rounded services, which includes like hopefully the managed care piece in the future. So looking forward to working with all of you. We have the housing, so I know I've been in contact with a couple people that are looking for placement, and so we're a provider on the housing side. So our communities are in the Sacramento, Stockton, and in the Tracy area, if anybody's interested. And so.
Awesome. Thank you so much, Shelley. Anyone else? Okay, perfect. We'll move on. Okay, so for today's agenda, as you can see, we have a preview of what we're going to be going through today. So after reviewing the agenda, we will go through the session objectives. And then as always, we do have space for general updates. So we'll be sharing some policy updates as well as some resources that are now available. We'll also have updates from each of our MCPs, as well as today we will be having a provider spotlight from Home Safety Services. We'll be talking a little bit more about their work. And then we are going to also host a justice involved refresher just to provide an overview, talk about eligibility criteria and services offered, as well as we'll talk about our upcoming office hours this week that will be building upon some of the information that we've shared during this session. And then we will close out with next steps. But before we do that, we do want to share information about our upcoming in-person session that will be happening in May. And we'll also give some folks time to register as well as share what they are looking forward to having us discuss as a group. And then we'll share information about office hours and one-on-ones. So for today's session objectives, we'll be reviewing important statewide DHCS policy updates, as well as sharing some resources from the marketplace, TA marketplace. We'll also receive important updates from the MCPs as well as stay informed with peer activities. And we'll receive a refresher on justice involved pre-release services, including an overview of the initiative, eligibility criteria, and services offered. Okay, so we'll move on to the next section, which is our updates. And sorry, I'm not keeping as much of track as the chat, but I will look at them at some point as I get the chance. So did want to share this as our final reminder on Cited. I know we've been talking a lot about Cited these past couple of months, and we did have the opportunity to have some breakout groups during our in-person session, but did want to share that the deadline for Cited is quickly approaching. In less than 2 weeks. The application will close on Friday, May 2nd. So did want to use this as a final reminder and push if you're considering to apply for Cited, that the deadline is fastly approaching. And then these are just some resources that we've shared in the past that may be helpful. And on to the next slide. Did also want to share an update on closed loop referrals. As we've shared in the past, closed loop referrals will be going into effect on July 1st of this year. And that is a requirement for the MCPs to implement closed loop referrals for ECM and community supports, with the aim to increase the number of Medi-Cal members that are successfully connected to benefits and services by improving information collection processes to better support individual referrals, as well as address system level gaps in referral practices and service availability that impact members. DHCS did release materials from the webinar that they hosted on February 13th, where they share more information around closed loop referrals and the requirements and how it will improve member referral processes, as well as they shared some example case scenarios. So we do have those linked in the slide deck. And at some point I will drop the link to the slide deck in the chat. But did want to share that update. We did also want to share a few updates around the TA marketplace. The first one is that in March, DHCS did release a TA recipient policy guide for folks on the marketplace, which includes various different information that's helpful, including information on recipient attestations, the TA project guidance, adding delegates, withdrawing projects, progress reporting, as well as name changes. So that is a resource that is now available. And then we also wanted to share some new on-demand resources. Some of these resources have been available, but just wanted to uplift them again. And that includes Medi-Cal Managed Care 101 for community supports, as well as ECM benefits. There's also various trainings on CalAIM, such as CalAIM 101, ECM 101, as well as a CalAIM Navigator video series, and some JI resources that include a re-entry toolkit as well as a billing toolkit. So all of these resources are linked within this slide deck. And then the last resource slash update wanted to share with you all is a white paper that was recently published by Full Circle Health Network called At the Intersection: Child Welfare and Enhanced Care Management, Tapping the Potential to Support Families. It is a report that offers key recommendations for increasing ECM enrollment among children, youth, and families involved in the child welfare system. So just one highlight from the report from recent data from DHCS does highlight that there are critical gaps in access, with fewer than 1% of Medi-Cal enrolled children utilizing ECM services and less than 4% of eligible foster care youth also receiving these essential reports. So the goal of this white paper is to provide some actionable strategies to close these gaps and strengthen support systems for vulnerable children and families. And then now we'll move on to MCP updates. So first we have Health Plan of San Joaquin. So did want to open the floor to Niyati to share updates.
Hi there, good afternoon. Can everybody hear me? I had some technical issues earlier this morning. Good to see everybody. Happy Monday. Nothing new. I mean, we are moving forward. We're working very closely right now. Our focus right now is justice involved in San Joaquin and Stanislaus. We are in production in San Joaquin County. For Stanislaus, we're making good movement as we plan to go live January 2026. This is for the justice involved population of focus. Another initiative that we're working very closely with in the county behavioral health realm is transitional rent. For Health Plan San Joaquin, we're going to be going live January 2026. So we're having really focused conversations with county behavioral health from contracting and a flex pool management perspective in both San Joaquin County and Stanislaus. So more to come. Again, anything associated with ECM referrals, community support referrals, all of that information is up to date on our website. We have the updated ECM referral form, and now on our CalAIM website, and I'll go ahead and drop that link momentarily, is that we have a list of community support providers. Remember, part of Health Plan San Joaquin's referral process for community support is that if you have a member that needs to be referred for community support, you can automatically refer them using the referral form. And we have a list of providers along with their fax numbers. Any questions for Health Plan San Joaquin that I can address? Okay, thank you, Navneet and team.
Awesome, thank you. Okay, so now we will move on to HealthNet. So I'll open up the floor for Ileana.
Hi, everyone. Good afternoon. This is Eliana Argueta. I'm the regional program manager here at HealthNet, overseeing the implementation of CalAIM in San Joaquin and Stanislaus counties. Navneet, I don't know if you want to go to the next page or if you're, okay, perfect. There are several pages that were also included in the appendix on behalf of HealthNet updates. So definitely want to flag that as an opportunity for this team to take a look at some of those updates after the call. Those updates include our current provider network for ECM and CS services. Let's go ahead and go to the next page. I wanted to flag an opportunity here as we are continue to be focused, as Nayeli mentioned, around the opportunities and support for our justice involved populations of focus. There is an event happening on April 26th, and in San Joaquin County, April has been formally acknowledged as Second Chances Month, and there's an opportunity coming up Saturday, April 26th at 10 a.m. at the Stockton Civic Auditorium, where members could come in and anyone in the community essentially come in and receive some additional services available, such as second chance employment, job fair, and expungement clinic, reentry resource fair. There's going to be a hosted lunch. There's going to be a proclamation by the elected officials in San Joaquin County, as well as an inspirational panel. So those are going to be some of those individuals and beneficiaries in the communities who also received a second chance. So a great opportunity for any of us to take advantage of learning more about our reentry services in the community. So I hope to see you there. If we can go to the next page. I wanted to continue to call out some of the HealthNet incentive programs. We currently have a doula incentive program, and this is across all of our counties. And we want to recognize and reward doula providers who show effective and timely outreach to eligible members, and providers can earn up to $100 per member. The incentive period is from January 1st through December 31st, 2025. For the sake of time, I'm only going to look at cover the eligibility, but definitely take a look at this slide after the call. The eligibility includes be in good standing with HealthNet, contract directly with HealthNet and as a doula provider, and openly accept and have the capacity to serve new HealthNet Medi-Cal members eligible for doula services. So any questions, you can always reach out to me, or you can also find additional information on our CalAIM for Providers page. If we can go to the next page. The second incentive I would like to call out is our Enhanced Care Management Incentive Program. This incentive period, again, is from January 1st to December 31st, with the eligibility, much like the doula providers. And the incentive measures include enrollment effectiveness, referral to community supports, provision of in-person services, reduction to avoidable ED visits, follow-up visits with providers within a 7-day of discharge from a hospital, and community referrals for ECM and CS services. Again, you can find more information on our CalAIM for Providers website. You can also reach out to me or to your point of contact here at HealthNet to learn more. And there's one more incentive. This is a community health worker incentive program, again, with the same incentive period, the same eligibility. And really, we're looking for awarding the best in class ECM services, focusing on enrollment, utilization, and connecting members to services to support all their healthcare needs. Again, let us know if you have any questions around becoming a community health worker or questions around this incentive program. And let's go ahead and go to the next page. I know we are, I don't want to take too much time. I wanted to provide additional information about a learning opportunity that HealthNet is hosting. This is going to be a CalAIM Provider Spotlight, part of our series where we highlight different community support services as well as enhanced care management populations of focus. The webinar on Tuesday, April 22nd will be around home modifications, and this is going to be presented by Rosarium Health. I wanted to call out that there have been some recent updates to the environmental accessibility and adaptations definitions and overview of these services. So we want to have this opportunity for our providers who are offering the service or providers who want to learn more about the service to attend this webinar. Again, it's scheduled for Tuesday, April 22nd. And it seems like we cut off the time there. I think it's at 10 a.m., but I can confirm the time for you and add it in the chat as well. And then there's one more. Actually, two more. So this is a Connecting the Dots series. Again, we continue to highlight the importance of our reentry population. As MCPs, we're working really closely with both Stanislaus and San Joaquin correctional facilities, as well as statewide with the CDCR implementation. So there is an opportunity to learn more about these services, and that's going to be hosted by DHCS on May 16th. And I believe this is from 10 to 11 a.m. And the webinar registration will be embedded in the slides I will send to this team after the call. The webinar is open to the public, including correctional facilities, counties, and county behavioral health agencies, managed care plans, and enhanced care management, community support providers, as well as anyone in the community that's open to learning more about this reentry population. Yes, we'll send that information via chat for Madison. And this is one last update that I wanted to provide. Part of the work here at HealthNet is oversight of the Indian health programs and traditional healing care practices is a new benefit that would benefit some of our members in these communities. We wanted to call out an opportunity to attend a webinar, and it seems like the slide was cut off at the bottom, but we'll include that information for you as well. This is an opportunity for a webinar to learn more about drug Medi-Cal organization delivery systems of services, including traditional healing practices. And so we'll send that information after the call. I will be in attendance. It's always, a great opportunity to learn about what additional services are available for our tribal organizations and our Indian health members as well. So if anyone is interested in learning more, definitely welcome you to attend the webinar with me tomorrow. If we can go to the next slide. I wanted to call out one last opportunity here for additional resources and leveraging learning more about CalAIM. This is particularly for our ECM providers. Our provider engagement teams will send these monthly bulletins to all of our ECM contracted providers, and this really includes an opportunity to learn about changes that may be coming down, particularly from HealthNet. I wanted to provide this update in regards to the mini myth. This is our member information file that our ECM providers receive, and it's really around the services, or I'm sorry, the identifiers around transitioning from incarceration or reentry population that just is involved. Just wanted to highlight that there's going to be 14 new columns that have been added to the template. And those additional columns will only be used to provide information for members who are, again, transitioning from incarceration to our ECM providers. It will not have an impact on those providers who are not receiving those type of referrals. But if you want to learn more, we also have our office hours for any sort of myth questions, RTF questions, return file questions. And so all those opportunities are also available under our CalAIM for providers page. So just wanted to call out some of these updates. And again, these are monthly bulletins that you should be receiving from our ecmdo@centene.com mailing address. I think, are those all my updates, Naveen? I know I had quite a few updates this month. And these are just continued, call outs or initiative or resources for initiatives that we're working under, either including ECM, CalAIM. I really wanted to call out this opportunity here, the DHCS listserv. These are the DHCS announcements, and where you'll see a lot of those updates coming from the MCPs. This is a great way to stay in touch with DHCS updates, including CalAIM information. Also wanted to flag some information around the Justice Involved Reentry Initiative for those who are continue to be interested in learning more. And I think the last page here for my updates just includes contact information and some additional resources directly related to HealthNet. Any questions from all those updates I just provided? And we'll send the webinar information via chat just to make sure you guys have it. All right, thank you so much. I really appreciate the opportunity to provide some of these updates.
Thanks, Ileana. Go ahead and pass it to KP, and I believe I'm passing it to Catherine or Camille.
So I'll be taking over this month's updates, but actually, if you go to the next slide, I wanted to kind of provide a quick update on all things happening on Kaiser Permanente kind of local engagement end. So we can go to the next slide. And so you all might be familiar with my face. I have been the local engagement lead for Kaiser Permanente Medi-Cal in Stanislaus and San Joaquin counties for the past several months. Our goal as the local engagement team is to really be your point of contact for all things Medi-Cal as it relates to relationships with network lead entities, our hub models, for example, or if you have questions about Kaiser's Medi-Cal program, if we don't know the answer, we're happy to kind of find those answers for you internally within the organization. Our team has been growing, and as you can see, Pat, who is based locally, is going to be taking over a couple of my counties. If folks join multiple PATH CPI meetings across the state, they might see myself or my counterparts in those other PATH CPI meetings. There are many of our local engagement leads across our 32 Kaiser Permanente counties serving that exact same function, making sure that we are able to kind of answer your questions and really engaging locally with things that are happening on the ground. So Kat is going to be taking over my role moving forward in these PATH CPI meetings and kind of the work as it pertains to Kaiser Permanente Medi-Cal. I'll still be around in the background. If you have any questions, obviously, feel free to kind of ping me if you have my email, and I can make sure that I send it over to Kat, who will be handling all things San Joaquin and Stanislaus. With that announcement, I'm going to go ahead and move us through a couple of KP updates. Mostly on our ECM influencer pilot results. So you might remember a couple of months ago, or Q4 of 2024, I kind of spent some time picking folks' brains around how are you learning about ECM services in your community? How are you figuring out that these services exist, or folks in your community figure out that these services exist? We ran an influencer pilot at the beginning of this year through the end of January, I think, and into kind of early March. We can go to the next slide. The pilot itself was MCP agnostic. We leveraged community-based organizations and social media influencers to create totally MCP agnostic education around what ECM services are for two specific populations, birth equity statewide and foster youth in San Bernardino and Sacramento counties. Those two counties specifically because we have higher membership in those populations for those specific counties. We built up research, we developed and piloted the whole program, and right now we're currently in the evaluation stage. The way that it sort of worked was in that formative research period, we pulled together packets of information, trauma-informed language approved by DHCS, all evidence-based, gave it to our influencer partners to create content. You can go to the next slide. I want to spend a little bit of time today providing updates on what we're learning thus far. So we had 32 posts total with a little over 500,000 total engagement. Video views around 51K across 17 influencer generated social media posts. 15 of our kind of participants or part of our cohort of influencers were kind of local social media based influencers. And 6 were CBOs actively engaged in the pilot, either identified by you all in our work, in our survey work that we conducted late last year, or in kind of one-on-one conversations that we've had with folks that have come up to us. We had a lot of really incredible engagement with folks. They felt that the campaign materials were valuable and easy to use. And we can go to the next slide and I can show a couple of examples of what those look like. I can drop some links into the chat around, our posts from earlier this year. They are both in English and Spanish, that linked to kind of, are you a person that's about to have a baby? Like you are eligible, or you might be eligible for ECM services under Medi-Cal if you add Medi-Cal. Here is how you can learn more. Go to DHC's website, things like that. So overwhelmingly positive kind of community engagement. I think we learned a lot about what hit and what resonated and what didn't. And if you go to the next slide, we've listed a couple of kind of quick snapshot learnings. So influencer-based approaches, feasible and promising. I think they're a really great way to amplify content in a super simplistic kind of way. We're all on our phones. Folks are listening to kind of things that they're hearing in the community, especially if it's from someone that's similar to them or has similar life experiences. Ready-made content is important, especially when leveraging influencers, ensuring that work is, or ensuring that the language is simple enough to be tailored for specific audiences. Really, really important to have straightforward referral guidance. And then for foster youth families specifically, it was really important for folks that were creating that content to really tap into those foster youth communities and tailor that content for that specific audience. I'm going to drop a link in the chat for, if folks have any thoughts, ideas, things they'd like to share. We're currently kind of collecting more information from folks. We want to hear from you around what you might be interested in kind of seeing down the line as we promote ECM and CS. We're hopeful that some of this work will be reflective potentially in utilization data across the board in the coming quarters. But we're still kind of parsing through the data and the outcomes, and we'll continue to kind of share more as we learn more. And that's it, I think, from Kaiser Permanente.
Awesome. Thank you, Camille. Did want to pause if there were any questions. I don't think I saw any in the chat. I know we shared a lot of updates, but did want to also hold space if folks on the call had any updates to share with the group. This could be updates or any type of spotlights that you would like to share, whether that's upcoming events or meetings or any recent successes that you think your peers would benefit from knowing. So I'm gonna pause and just open the space if anyone would like to unmute and share any updates or successes or spotlights. No, folks are doing a lot of great work, so would love to hear about that if anyone's willing to share. Right, like got a quieter group today. So we will go ahead and move on to our next section of the session, which is our provider spotlight. So I do want to open the floor to Tim from Home Safety Services to share a little bit more about the work that they do.
Thank you, Navneet, and thank you to everybody from the plans and all the work you guys do, and good afternoon, everybody. My name is Tim. I'm with Home Safety Services, and I wanted to talk to you a little bit about what we do in the home modifications and the environmental adaptation space within CalAIM's community support. If you go to the next slide. Next slide. Click one more. There you go. So just very briefly, the 30-second commercial on who Home Safety Services is. We are a regional Joint Commission accredited home modifications provider, and we specialize in falls prevention through the installation of grab bars, railings, wheelchair ramps, lifts, bed and bath safety. One of the things that separates us from all other contractors and people who are in this space is we are accredited by the Joint Commission. And what does that mean? That gold seal you see on the screen there, we have the same accreditation that hospitals do, skilled nursing facilities, and other medical facilities. And that is given out by the federal government. It's reassigned every 3 years after a rigorous inspection of our business. And we are on our third continuation of that. So we're quite proud of that. And we are the only home modifications company in the United States that has that seal. And we went out and obtained that seal because we feel that home modifications is part of the healthcare continuum, and it's a patient problem. This is a care situation. So we wanted to place ourselves within the care management team. And with Medi-Cal, this is the social determinants of health. We needed to be part of that care management team. We service most of Northern and Central California, from Fresno to the Oregon border out to Sacramento, and also approaching into Nevada also. Next slide. So CalAIM benefit, what are the requirements for anybody obtaining home modifications? They need to be a plan member, nursing home eligible, and there needs to be medical necessity, and that medical necessity needs to come from a healthcare provider, whether it be a nurse, a case manager, a nurse practitioner, or a physician. Go ahead. The full description, it's really interesting. In the past, a lot of these programs just encompassed maybe grab bars and bath benches, but this is the full spectrum program. It not only includes the grab bars and the bath benches, but also lifts and ramps to a lifetime cap of $7,500. It does exclude DME, which usually includes a bath bench or a transfer bench, sometimes a handheld shower, but that is covered in another funding bucket within CalAIM. Go ahead. So what is a protocol for referral? As everyone's heard before, it's any door, and that is applicable here. Anybody can refer a client for home modifications, even the individual themselves. We receive referrals across the board, usually from the health plans, but we do also receive them from ECMs, case management individuals, discharge planners, and also the individuals themselves. What happens with these referrals is once we receive them, since we are the installer, we usually receive that referral after it's been authorized. But if we see it before it's been authorized, we go through the same channels. We input the information via a portal or a paper application, fax it, or email it back into the plan, and the wheels are turning at that point. Once the authorization comes through, and the work is okayed, we perform the work, the client signs off on the work, and then the paperwork is submitted back into the plan. Go ahead. One more. There we go. Thank you. So these are just a brief visualization of some of the benefits that are available in the home mod space. You see the gentleman there with a floor-to-ceiling pole. That's a great option in and around the bathtub, shower, toilet. It acts as a dual purpose, so the individual can safely transfer from either a chair, the toilet, to the bath, back to the chair or the toilet. Of course, grab bars come in all shapes, sizes, colors, textures. They can be custom made. They're all lengths. There's really no end to what is available now with grab bars. We do door widening, which is a very common for people needing to access certain rooms and they can't because of they're now in a wheelchair. And then, of course, there are many solutions in and around the toilet. Go ahead. So we do indoor-outdoor railings. These are much like grab bars. They're custom made, they're customizable, different textures, shapes, sizes, colors. They can be manufactured to match any aesthetics in a home. They're all manufactured here locally in California. We also do indoor-outdoor lifts. So there are straight lifts and curved lifts. And then also we install small ramps and then aluminum modular ramps. We only do modular aluminum ramps because of their cost and also the fact that they're recyclable. They're not damaged by the sun or the wind or any insects. They're very easy to install, usually takes between 1 to 2 hours, and they can be removed and the home looks just like it did before the ramp was installed. Next slide. So this is a case history. We went out and did, this is actually a CalAIM case. The individual, I think, broke his hip. He was in a skilled nursing facility for several weeks. He was assigned to a power wheelchair. The caregivers and family members needed to install something to get them into the home. So they threw down this plywood board. It works for a while, it's great, but after the sun and the rain and the bugs get to it, it can cause another problem. They had an authorization through CalAIM. The ramp was approved. We came out. This ramp is a 6-foot ramp. It costs less than $4,000. It was installed in less than 2 hours. And once the individual is done with his wheelchair, this can be removed and there's no damage to the home. Next slide. Once again, another CalAIM case management. The individual needed railings to get in and out of their home through the front. It was approved, authorized. The work was completed. And this was, it took less than 3 weeks for this individual from start to finish to receive a ramp, or excuse me, a railing. Next slide. This is the small, what's called a suitcase ramp or a portable threshold ramp. This is a great solution to be used when the thresholds are not that tall. We can come out, install that in less than an hour. It's attached with just a couple screws into the cement, and the individual can either walk or roll his walker up or a wheelchair safely into their home. Next slide. So I went through this rather quickly. Naveet wanted me to answer a couple general questions here, but I will open it up to more specific questions. And some of the questions she had was, what are some of the pain points we've experienced? So we've been CalAIM contracted vendor for, I think, 3 years now, 3.5 years. And I think one of the biggest pain points we had was the integration of the health plan systems into a small business. We needed to bring on more staff. We needed to upgrade our systems. We're a small company, but we're very nimble, so we were able to do that. But it's caused, some delays on our part. We needed to learn new systems, new portals, new workflow processes, and they change frequently, so we need to keep up to speed on that. Some of the other questions were CalAIM brought, so she wanted me to address there we go, best practices. So I think one of the biggest things that we've come across and have encountered is we've interacted now with a lot of different people than we ever would in our space. Our space is a very small space. It's home modifications. This is all we do. We don't build homes. We're not out rebuilding bedrooms or ADUs. So we're kind of contained, but it's really brought together a lot of different people that we've had to interact with. We've expanded into different areas of rehab and working with OTs and PTs. So it's been a great opportunity for us to learn and interact with a lot more different people. And I will now open up to more specific questions. Quiet group. Well, if there's no other questions, thank you for your time. I appreciate that. And have a great day.
Great, thank you so much, Tim. And if questions do come up, feel free to email them to me or Tim. I'm sure we'll be happy to direct them to him as well. Okay, so now we're gonna move on to the next part of our session. Sorry, 1 second. And now I will pass it on to Rebecca, our guest speaker.
Thanks, Navneet. Rebecca Karazi, appreciate the opportunity to be with you guys this afternoon to provide a refresher on the Justice Involved Reentry Initiative. So let's jump right in. Next slide, please. Okay, in a couple years ago, in 2023, California became the first state in the country to get approval from the federal government to be able to use Medicaid dollars, known as Medi-Cal here in California, to provide services to individuals who are incarcerated in our state. This was achieved through what's known as a Medicaid demonstration waiver. It's the same vehicle that was used to get approval for the CalAIM initiative in general, more broadly. Next slide. As I work across the state in this area, I've come to realize that just giving that overview of the JI Reentry Initiative and California's sort of positioning as the first state to do this, I find what's often lost is what is the impact of this on Medi-Cal here in California, on the system, and what is the impact not just on the system, but for individuals on Medi-Cal who are incarcerated in California. So I want to share this slide with you, and I want to share the two fundamental changes, the two fundamental systems shifts that are happening as a result of this initiative. The first is that Medi-Cal is effectively expanding to include individuals who are incarcerated in certain facilities in California. This is essentially a Medi-Cal expansion. So that's the first shift that's happening. For the first time, individuals are going to be able to be covered by Medi-Cal when they're incarcerated. And that's California's approval from the federal government was to be able to do this. It's otherwise individuals who are incarcerated have their Medi-Cal suspended. So this is the first big shift. The other big shift is that in order to enable the ability for Medi-Cal services to be provided to individuals who are incarcerated in California, correctional facilities are now going to become Medi-Cal providers. Essentially, they are going to be folded in to the public healthcare system in California. This is huge. It's a major shift from the status quo, and it's a multi-year effort to stand up the infrastructure and build the capacity among correctional facilities to be able to operate as a Medi-Cal provider, both from a service provision standpoint, but also from a billing and payment standpoint. Next slide. Okay, so why does this matter? Why is the state putting so much energy into this population of focus, the justice-involved individuals who are incarcerated or formerly incarcerated in California? Well, it turns out that this population has a much higher disease and illness and injury burden than the general population. This spans physical health needs. That would be things like heart disease, diabetes, but it also spans behavioral health needs, mental health issues, substance use disorders. So a much higher burden of health needs among this population. Obviously, this initiative, CalAIM as well, is overseen by the Department of Healthcare Services, so health is first and central in this initiative. We also know here in California, as well as across the country, certain groups are incarcerated at a much higher rate than other groups. And especially we see this among Black men. So this is also an equity issue. Next slide, please. Thanks, Navneet. I go fast sometimes. All right, so hopefully this is not the first time you guys are seeing this puzzle piece diagram. It was developed by the Department of Healthcare Services to demonstrate all the various components that make up the Justice Involved Reentry Initiative. Also, by the way, the JI Reentry Initiative used to be called the JI Initiative, so those are the same thing. It got rebranded not too long ago. But in any case, what you see on the screen is really a representation of all the pieces that come together to make up this initiative. And what I want to illustrate for you on this slide is that while you see enhanced care management and community supports noted here as critical pieces of this initiative, they're not the only pieces that the state is focusing on with regard to this population of focus. There's a lot more going on, and especially a lot going on with regard to those correctional facilities that I mentioned earlier. There's an initiative to support individuals to enroll in Medi-Cal while they're incarcerated. There's services provided to individuals while they're incarcerated. There's what's known as behavioral health links, which is intended to support continuity of care for behavioral services between those services that an individual is getting during incarceration and making sure they have behavioral health services upon release. So we'll go to the next slide. And I want to emphasize for you guys that I've kind of alluded to it in some of the ways that I've talked about correctional facilities already, but this initiative is only focused on certain correctional facilities in the state. It's not all correctional facilities. So specifically, what facilities are covered are state prisons, county adult correctional facilities, the jail facilities that are overseen by sheriff's offices, the county level, and county youth detention facilities, which are overseen by probation departments at the county level. The facilities not covered are federal prisons, Department of State hospital facilities, and city jails, not covered as part of this initiative. Next slide, please. So here I want to just go through who is eligible to get services under the JI Reentry Initiative. So of course, individuals have to be on Medi-Cal. First and foremost, no matter what, it's almost like a prerequisite. They have to be on Medi-Cal in order to get any of the services under the JI Reentry Initiative. Very similar to CalAIM, you have to have managed care to get ECM and CS, for example. So Medi-Cal is a critical piece of this. Then if the individual is located at a youth detention facility, then they will qualify. If they're on Medi-Cal, they'll qualify to get these services. In addition, if they're under 21 years of age or a former foster youth under 26 years of age, again, they just need Medi-Cal to qualify. If they don't fit into any of those buckets, then they're probably an adult in an adult facility. And those individuals also, in addition to being on Medi-Cal, need to meet additional healthcare need criteria, which are listed on the screen. So they would need to demonstrate at least having one of these: mental illness, substance use disorder, a chronic condition or significant clinical condition, intellectual or developmental disability, TBI, traumatic brain injury, have HIV or AIDS, or be pregnant or postpartum. So while we know there is a higher disease burden and illness burden among this population, this list will cover the vast majority of individuals on Medi-Cal, but it will not cover everybody. So that's important to know. The state does anticipate around 80% of individuals on Medi-Cal going into carceral settings will qualify under these conditions. The other thing I want to note before we move to the next slide is that these are the same criteria for individuals receiving enhanced care management under the individuals transitioning from incarceration or the justice involved population of focus. We often will call it either of those two names. So what that means is that anyone who qualifies to get pre-release services or services through Medi-Cal while they're incarcerated will automatically qualify for ECM up to 12 months post-release. So that's really important because we want that continuity of care management going from pre-release to post-release. I do lastly want to mention that ECM is opt-in. So even though individuals will may automatically qualify in pre-release, they still have to opt in to ECM. And even if they don't qualify for pre-release, but they eventually meet these criteria, they can qualify if they were formerly incarcerated up to 12 months post-release for ECM. Next slide, please. Okay, so what services are actually covered while an individual is incarcerated? The list is here. This is directly from the state slide that you're looking at. So top of the list, we have care management. And I'm just going to say I'm going to dive into care management in a lot more depth on Thursday during the office hours. So please join me and anyone else. Please come if you're interested in that topic, more detail there. Also covered are a bunch of physical and behavioral health clinical consultation services. These are things that are needed to diagnose a condition and treat conditions. So there's a whole long list of these things. Also, labs and radiology are covered. Medications and medication administration are covered. And then a special type of medication, MAT, or medication-assisted treatment for individuals who have substance use disorders, is also covered under this initiative and needs to be made available to individuals who have substance use disorders. So this is a really critical piece of standing up services in correctional facilities. And then finally, we have community health workers. This was a service that became available in the community not too long ago. It's also being extended to individuals during incarceration. And then finally, at release, there are 2 additional services. So individuals are going to be in a position to walk away with medications in hand. The amount, it's typically going to be a 30-day supply, but it sort of depends on the medication and what's clinically necessary. But in any case, they should be walking away with medications in hand. And the idea there is that it will help them get to their next appointment in the community. They'll also have the ability to walk away with durable medical equipment. So if they need a walker, let's say, for example, they can leave the facility with that equipment. Next slide, please. Okay, so now I'm going to talk about the most exciting topic of this, which is money, and specifically reimbursement. So I've divided this screen into 2 categories. First, on the left, you see pre-release or detention. So this is the model, the reimbursement model that's occurring while an individual is incarcerated or detained. On the right, you have post-release or in the community, once an individual returns to the community post-release. This is a different model for reimbursement. The model on the right is the one that this group is probably largely familiar with because this is the same model that's used for ECM and CS services, and that's Medi-Cal managed care. So all of you guys are probably quite familiar that in order to provide ECM and CS services, you need to have a contract with a managed care plan, and your billing actually goes through the managed care plans as well to get reimbursed for those services. This is not the same reimbursement model that's being used for pre-release or when an individual is incarcerated. The model that's being used is known as Medi-Cal fee-for-service. So managed care is going to have nothing to do with what's happening inside the correctional facilities. Instead, as I mentioned at the very beginning, correctional facilities will actually become Medi-Cal providers. They're going to become unlicensed clinics officially. And they're going to be enrolling as a Medi-Cal provider and then billing the state directly for services that are provided to individuals while they're incarcerated. Other providers may be involved as well. There may be some in-reach providers involved who would also then need to enroll as a Medi-Cal fee-for-service provider in order to get reimbursed for any services that are provided to individuals during incarceration. This becomes really, really important to understand if you are a provider that's straddling these 2 worlds. If you are operating both in the community serving individuals post-release and serving individuals pre-release, then you're going to have to set yourself up so you're operating both in the managed care world as well as the fee-for-service world. I'm going to dig into more on this on Thursday during office hours to talk about what the impact of this is for the care management component, ECM providers, and pre-release care management. So come on Thursday and we'll dive deeply into this one. Next slide, please. Okay, wanted to share this slide with you. It's actually, I was looking at it again today and I realized this is actually not even sufficient, a sufficient list, but what this is a slide that the Department of Healthcare Services recently shared to illustrate how many different partners are involved in order to implement the JI Reentry Initiative. Of course, correctional facilities are involved and have requirements under this initiative. There's also community-based providers. Pharmacies are going to be involved because medications are covered under this initiative. And we even have other providers in the county, such as county behavioral health agencies that are part of behavioral health links. We have social services departments, not listed here, but they play a critical component when it comes to enrollment in Medi-Cal. And then we also manage care in the community, along with the ECM providers in the community who are playing their own roles to support continuity of care for individuals post-release. So a lot of players here that haven't always worked together, right? Needing to come to the table to collaborate around this really important initiative and ensure that it is ultimately successful. Next slide. Okay, so now that I've sort of gone through all the policy stuff, I wanted to just take a quick step back to say, okay, what does this look like from an individual level perspective? And I will say out of the gate, this is a grossly simplified version of what an individual could expect to see if they were going to be serviced under this JI reentry initiative. So it all begins with an incarceration or detention. An individual enters a correctional facility that's covered under this initiative. Very quickly, there will be some assessments that are done, probably some services that are provided, and hopefully also very quickly, there will be a step of verification of both Medi-Cal. Is the individual on Medi-Cal? Remember, that's like a prerequisite to get these services. And also, is the person eligible to get pre-release services covered by Medi-Cal? So that eligibility and verification will be occurring hopefully very quickly and very close to getting booked into one of these facilities. Of course, there will be a period of pre-release services being provided. And then as the individual's heading towards their release and release back into the community, there will be a period of time of reentry planning. And this will include things like developing a reentry care plan, which will actually transition into the care plan for ECM in the community to help guide what the individual's care needs to look like and who their providers will be post-release. That will lead into this next step of handoffs and linkages, which is really about getting providers connected, pre-release providers connected to post-release providers, to talk about that individual's care and to hand off to each other, and to establish appointments in the community for the individual when they return. And that's the last step, returns to the community. So there's a lot of pieces in just the simplified version, but please note that the experience going through these steps will look very different for individuals depending upon many factors: their individual health status, their status being on Medi-Cal or not, which correctional facility they're in, how long they're in those correctional facilities. For instance, there's a lot more time for the state prison system to work through this process in a timely way because there's often a known release date, whereas at the local level in the counties, that's not usually the case, and the stays are a lot shorter. So there's a lot of variation that's going to happen, but this is sort of the basics of the vision of the JI Reentry Initiative. Next slide, please. Okay, milestones in terms of timeline, where we've been, where we are right now. Back in January of 23, a mandate went into effect that required correctional facilities to provide support to individuals to enroll in Medi-Cal if they were not enrolled upon incarceration. Then in January 24, that's when ECM for this population of focus went live statewide. And now we're in this 2-year window that started in October of last year, and it goes till September of 26, when correctional facilities are going to be launching these pre-release services. And they have the option at any time in this window to launch those services. So it will not be until the correctional facilities launch, and they have the choice to do this within this time period. All those warm handoffs and linkages, for instance, to ECM providers, will not happen until the correctional facility has gotten to their launch date. So just be aware of that in terms of how all of this is meant to flow. It really needs to start with the correctional facilities going live, and then all of those other linkages and services are going to fall into place from there. Next slide, please. Okay, so I want to just bring this local. So in your region, this is, at least to my knowledge, where things stand with regard to your correctional facilities. So in San Joaquin, as Nayati mentioned earlier in the discussion today, the adult facility in San Joaquin has gone live as of January. I'm actually not certain of what the status is of the juvenile facility in San Joaquin. So if anyone knows that and wants to put in the chat or chime in, please share. In Stanislaus, I think Nancy also mentioned that both the sheriff's facilities as well as probation facilities for youth are working to go live in January of next year. And then I also want to share that the California Department of Corrections and Rehabilitation, CDCR, the state prison system, has launched as well as of February of this year. And that's important because even if locally, let's say you're in Stanislaus, even if your local correctional facilities have not launched, since the state system has launched, individuals in that system can return to any county in California. So providers, ECM providers, CS providers should be aware that this is happening, and you should be prepared, especially the ECM providers. If you're serving this population, you need to be ready, and maybe you've already been called upon to support transition of care for these individuals into the community. And there are activities that you'll be expected to do before an individual returns to the community. So just be aware that this is happening if you've not already been tapped in for your services with regard to this population. And I think that's my last slide, Navneet. So happy if we have time to take questions. Otherwise, I'll turn it to you for closeout.
Yeah, I think we have a few minutes if there are any questions that folks want to voice over or put in the chat.
I'm gonna call out Nayeti. Do you know, Nayeti, what the youth detention situation is in San Joaquin right now? They've launched as well.
Hi, Rebecca. This is Eliana with
Okay,
HealthNet.
Eliana.
I believe Nayeti had to drop. I was actually looking at my notes. I want to make sure that I provide you with the right information here. I think we are expected to go live in San Joaquin County for the youth early 2026.
Okay, great. Thanks for the update. I appreciate it a lot.
Yeah, absolutely.
All right, no questions. You all just waiting for Thursday's office hours to dig into care management, I guess.
No, thank you so much, Rebecca. I really, from an MCP perspective, really appreciate this overview. I think you're bringing and lifting different aspects of the conversation that we may not have touched. So I really appreciate this update and the Health Begins team for putting it together as well. I think another great call out is a DHCS webinar that would happen that is being held on May 16th. I think that's a great another opportunity for anyone on this call to learn a little bit more about the JI reentry population of focus and just some of the services that are available for the teams here. As noted in the appendix, I did include our current provider network. So please let us know if you have any questions about making those referrals to our current members who may be eligible for these services as well.
Great. Sounds good. I will say I've worked with correctional facilities across the state on this initiative, and I think my estimate is it takes 10 times to hear this before it really starts to sink in. There's a lot of pieces to this. So if you're feeling overwhelmed, by the whole JI reentry initiative, you're not alone. Like there is a lot going on here, and there is no analogy or analogous population of focus to this one. There are so many unique things happening here. And definitely know that you're in a camp of a lot of other people who are still really trying to figure this out, and especially because the state's still building the plane while they fly it. So just know this is a big shift, and that's why I wanted to start the presentation with this is a systems change thing that's happening here with regard to the correctional facilities. Really a big deal, and it is starting to sweep across the country. So hopefully we'll continue to see movement in this direction. Any other questions? A link for Thursday's webinar. I already put it, you guys are on it. Okay, great. Cool.
Awesome. Thank you, Rebecca. That was really great. And like she mentioned, we are going to be diving a little bit deeper into this information on Thursday. So I did put the link for the office hours in the chat, and we can share it out again. But if you've already registered for office hours, it should be on your calendar and you should have the link. Okay, so now we're gonna move on to next steps and closing. Excited to share information about our upcoming in-person session, and I will drop the registration link in the chat if you'd like to take a moment to register as I'm kind of walking through the information. So our in-person session is going to be happening next month on Wednesday, May 21st from 10 a.m. to 2 p.m. And we'll be hosting it at the San Joaquin General Hospital and French Camp. And like always, our in-person sessions really are an opportunity to support relationship building among local providers, share best practices, discuss opportunities for improving provider referral coordination, and more. You'll notice when you click on the registration link, the last two questions are really tailored towards what you are interested in seeing at the upcoming session. So really encourage you all to fill that out and let us know what you're interested in having us kind of walk through. I know there's various different ways that we could go about the session, but really want it to be driven based on what would be most helpful. And the session is open to all local health and social service organizations, including hospitals, CBOs, tribal programs, direct service providers, FQHCs, county agencies, and more. And it's open to both counties. So encourage you, whether you're in San Joaquin or Stanislaus, to come join us on Wednesday, May 21st. I know our in-person sessions are really popular, so we've been trying to have more of them this year. So hopefully you all are able to make it out. And if any questions do come up, always feel free to email me. I'm just gonna come back. Right. We did want to ask the group a question. As we know, with the current landscape, there has been certain funding cuts. I know there are some organizations that have gotten their funding cut through COVID dollars. So just want to take a moment to kind of check in with folks and hear if you all have been impacted in any sort of way by the recent federal and state funding cuts. And you're welcome to share this via email, but just wanted to take a moment to check in with the group and see kind of where we are all out. And I see, Carrie, you started your video, so I'm gonna use this as a prompt that you want to share something.
You're funny. Yeah, I mean, I will just say we have lost some funding. We had a COVID-19 grant that was abruptly finished, cut off, and then we have emergency food and shelter dollars that we were approved for, and then that was just abruptly also denied. And then the first 5 funding, which I'm not sure if it was directly related to federal cuts or not, but that has been drastically cut for us as well. So yeah, unfortunately, we have seen some pretty significant cuts, and not great.
Yeah, thank you so much for sharing. I know we've been hearing it across from a few orgs, so just want to check in with our participants to hear and see if there's anything we can do to support.
Well, and it's just a follow-up question. I mean, I don't know that anybody has any answers, but of course, everybody's concerned about, the proposed cuts to Medicare and Medicaid and how that will trickle down to Medi-Cal. And, I don't know that anybody knows anything, but if they do, let me know.
Yeah, I know at this point we have received guidance from DHCS that there won't be any impacts to current work. But I know the landscape is constantly changing, so we're keeping an eye on things. Anyone else have any thoughts or questions? Okay, well, we'll keep everyone updated. Thank you so much, Carrie, for sharing. So that takes us kind of to the closing of the session. Again, just wanted to share another reminder about our upcoming office hours that are happening this Thursday at 11 a.m. To 12 p.m. This will be a joint office hours with our Northeast Collaborative as well. And like Rebecca mentioned earlier, we'll be providing more regional updates, resources, and requirements, as well as diving deeper into care management models. And then, as always, just wanted to share another reminder about one-on-one opportunities. So if you have questions, want to dive deeper, and would like to meet with us, we're always open to doing that. And I have my email on the slide. If any questions come up, I'm sure you all already have my email based on all the emails I do send out. So just wanted to share that reminder again, and hopefully we'll see you at office hours this Thursday. But if there aren't any other questions or any other thoughts bubbling up, do you want to take this as a moment to say thank you to everyone for joining today's session? I know we covered a lot of information and appreciate you all sticking with it. Yeah, hope you all have a great rest of your day. Thank you so much.
Thank you.
Thank you.
Bye.